We've used data from the NHS for England for the last 19 years to look at all patients having shoulder replacement surgery for arthritis. We estimated the risk of serious medical complications and also the risk of needing a further operation or revision of their shoulder replacement at any point in their lifetime after that. We found that the risk of serious medical complications are a little higher than previously shown, and they approach 1 in 28 for patients within the first 30 days of surgery and 1 in 22 within the first 90 days. Patients over the age of 85 have a much higher risk, whereas patients who are younger, the risk is much lower. For lifetime risk of further surgery, in patients who are under the age of 60, we found that the risk of further surgery may be as high as 1 in 4. And again, in older patients, the converse is true, and the risk of further surgery is much lower. At least half of that risk of revision surgery occurs in the first 5 years. So we know that shoulder replacement surgery is an effective treatment in reducing pain and disability for patients who have shoulder arthritis. However, it's a major operation, it does come with some risks, and whilst for most patients those risks are relatively low, for some patients we have found that those risks are much higher, particularly the risk of serious medical complications in older patients, and also in terms of how long the shoulder replacement may last for patients who are younger. So we hope that patients and their clinicians will be able to engage in more detailed conversations about how this may affect them and the decisions they make in deciding whether to have a shoulder replacement operation. So we've broken down all of the estimates in our paper by age and sex so that patients and surgeons can have conversations which are specific to them. What's unanswered at the moment and needs further research is really trying to predict which patients will benefit the most from the surgery, and so we can really understand that balance for the individual. So we'd like to thank our funders for supporting this work, particularly the NIHR Biomedical Research Centre in Oxford, the Royal College of Surgeons of England, the National Joint Registry and Versus Arthritis.